are off a little bit. Make these. Just a second, we're gonna get started. I know somebody needed class 3 and 4 on the review sheet. Anybody else need review sheets? 3 and 4, class 3 and 4 on the review sheet. You needed 4. 4. 4. 4. Yeah. Anybody else need anything else? Good. Two seconds. I'll put on the chat here. All right, did you guys, and I know this has a blue book, I haven't updated the slides for this one yet. So it's a yellow book. Did you guys do the reading chapters 5 and 6? And did you take the test? Yes. All right. So let me go ahead and get your scores. This is for chapters 5 and 6. Jillian. Shaylin.
105 and I just 106.
Thank you. Tara.
105 and missed 106.
Thank you. Bernice.
100 on both.
Thank you. Gianna. Bailey.
100 on both.
Very good. Patricia. Stephanie.
100 on 5.
Thank you. Melanie. Thank you. Jessica.
This one, 5 and 106.
Thank you. Cynthia. JC.
I missed 1 and 5 and 1 and 6.
Thank you. Rachel.
I got 100 on 5 and 85 on 6.
Thank you. Do you happen to have 4 for me as
Yeah.
well?
I got 85.
Thank you. Amber. Any questions on what you missed?
For 6, it was number 2. I guess I just got the position wrong. Yeah, I got lateral at first and I realized it was sim. Yes, that's the one I got wrong too.
Yeah.
I remember going back on what? Because I was like, I seen the one diagram, but I was looking further in the chapter. I was like, oh, okay. Yeah.
Yeah, whenever I was going back, I'm like,
Yeah, it's mentioned very, yeah, very minimally, but we do need to understand the positions because it is used in healthcare. If we're going to do a procedure on somebody, we may tell you, hey, make sure the patient is in bed in the prone position before the doctor comes in 5 minutes. So you need to know what prone position is. Now, everybody's got their own little ways of remembering this. Okay. I'm going to tell you mine. You may come up with something different, but this is how I remember each one of those positions. Supine is on your spine. Okay, so supine is on your spine. Prone is posterior up. Okay, so P and P. Prone is posterior up. Fowler's is kind of a hard one. I mean, how do you remember what Fowler's is? So what I came up with for Fowler's is another name for chicken is fowl, right? So if I'm going to eat chicken, what position do I need to be in? Sitting upright. So Fowler's is sitting upright, fully upright. Lateral is laying on your side, lateral laying. And Sims for me is my sleeping position. I sleep on one side with my knee drawn up, right? So that's my sleeping position. So Sims, which is a mattress company, right? So Sims position is my sleeping position. So that's how I remember them. Now you might come up with things that are a little bit more suited to you, but that's how I remember each one of those. Okay. But you do need to know those positions. And I know the chapters don't really go over it real well. But you do need to know those just because we use them in healthcare a lot. So I do want to say something about that. When you start working, nobody's expecting you to know everything. Yeah, I am. Okay, I am like, nobody's expecting you to know everything. So there's going to be things that we're going to go over in class that you're just plain going to forget or not get to begin with. It's a lot of information being thrown at you all at one time. The worst thing you can do is fake it. These are people. This isn't a fake it till you make it type of deal, right? So if I tell you the patient is NPO until noon, and you have no idea what NPO actually means, don't pretend that you do. If I tell you the patient's NPO until noon and you don't know what that is, you need to tell me, I'm not familiar with that abbreviation, or can you remind me what that means? Okay. Let me tell you a story about this. This is a true story. It happened at a large teaching hospital in Tampa. Cardiac cath lab nurse went up 5 o'clock in the morning to get the first patient for the first procedure of the day, first cardiac cath. When she goes into the room at 5 a.m., the patient's sitting up in bed eating. There's a tray in front of them. Now, this patient was supposed to be nothing by mouth before the procedure. And the nurse comes in, looks at the patient eating and goes, oh my gosh, you're supposed to have a procedure. Why are you eating? He says, I don't know. The nurse brought this in and said I had to eat it before the procedure. So the cardiac cath lab nurse, we're going to call her Kathy. She goes out and finds the nurse responsible for that patient. She says, why is this patient eating? And the nurse says, I don't know. He was scheduled for a cardiac cath. He's eating? And she says, yeah, he's eating. So she says, I don't know, but there's a student nurse assigned to that patient. So let me go get the student nurse. So the main nurse goes and gets the student nurse, brings her to the cath lab nurse. And this is the conversation they had. I'm going to play both parts. Kathy, cardiac cath nurse, says, why is the patient eating? Student nurse says, because the patient's NPO. Kathy says, I know the patient's NPO. Why is the patient eating? And the student nurse says, because I went and got the tray special myself. Kathy says,
this makes no sense. The patient is NPO. What do you think NPO means? Student nurse says, Nana's, pineapples, and oranges.
Oh my gosh. Oh my gosh.
Okay, first of all, Nana's is not even a word,
Oh my God.
right? That's not even a thing. Yeah, Nana's, pineapples, and oranges went and got a fruit tray for this patient before the procedure. Yeah, Nana's, pineapples, and oranges. Yes. Yeah. So here's the long-term. Now we can all laugh about that, right? But here's the long-term consequences of this. This patient was not able to get his cardiac cath. That is dangerous. That patient could have died from a myocardial infarction or a heart attack in the time it took to get him rescheduled. That is dangerous. The second problem is you've got a cardiac surgeon waiting in the cardiac cath lab with no patient, no money. You think that makes them happy? They're going to be mad. And now the room's got to be completely torn down and reset up for the next procedure. That's time and money and staff resources. So this student nurse, not knowing what an abbreviation meant and not finding out what the abbreviation meant, winged it and inconvenienced all of those people and put a patient at risk. So, of course, the instructor got involved and, we went over this in class. Well, I was absent that day. Yeah, probably not. Probably not. Don't wing it. If you don't know what NPO means, ask. I'm sorry, I'm not familiar with that. Can you tell me what that means? Or can you refresh my memory? It's okay to not know everything. It is not okay to fake it.
It's nothing by mouth. Why is it NPO?
Okay, so this is a question that comes up a lot that doesn't make any sense, right? So Nana's, pineapples, and oranges makes more sense, even though Nana's isn't a real word. The reason that NPO stands for nothing by mouth is because it's not abbreviated English. It's abbreviated Latin, because Latin is the language of science. Now, in order to understand why, we have to go back about 300 years in time. About 300 years ago, medicine was just starting to come out, right? Just starting to really be formed. And, some people were doing experiments here and there before that, but it became an actual training that you could go through, right? So there were training institutions in Germany and France and England and India and China. And these people that were learning medicine had to have a way of communicating their findings, their experiments to other people. Well, if somebody is speaking Chinese, they can't really communicate effectively to somebody speaking German. So we had to have a single language that would unite everybody in the scientific community, and everybody learned Latin in university at that time. So it became the language of science. So NPO is actually nota per ora or nota per os, which is NPO, which means nothing by mouth in Latin. Make sense?
Makes sense now.
So a lot of our abbreviations are abbreviated Latin. So they're not going to make sense in English, like BID. What in the world is BID? Well, B actually stands for bi. How many wheels does a bicycle have? So B is bi, or two. BID would be 2 times a day. TID, T stands for try. So what do you think TID means? Q is for quad, 4 times a day. Make sense? Okay, but we don't use QID anymore because there's another use for Q. We used to years ago, but there's another use for Q, and it's quoque, which means every. So if you have QID, oh, that meant 4 times a day. But if you had QD, it meant every. Anybody ever see a doctor write anything? Right? QID and QD looks a whole lot alike when a doctor is writing it. So we had to get rid of that QID, right? So Q in medicine now stands for every. So QD would stand for every day. QAM, yeah, believe it or not, AM is Latin. We think it's English, but it's not. It's Latin. It's ante meridia, which is before the middle. Right? The middle of the day is noon. Make sense? PM is post meridia or after noon. So AM and PM are actually Latin. We don't think about it that way. We think they're English, but they actually stand for Latin words. So QAM is every morning. QPM is every night. Now, bedtime's a little bit trickier because they call it QHS, or every hour of sleep, or a somni. So that would be bedtime. QHS is bedtime, the hour you go to sleep. Good? Make sense? So in order to understand all of those, go in your book, turn to page 61.
It's not on the CNA stated.
Yeah. Very few will be on the CNA state exam, but there will be a few that will show up. Now, they're not going to ask you, excuse me, what does NPO mean? They're not going to say that. They're going to use it in context. So most of the questions on the state exam are not concrete questions. What is this? They're more scenario-based questions. What are you going to do when you see this? So a question on the state exam might be, your patient is in PO after midnight. The CNA can expect A, to turn and reposition this patient every 2 hours around the clock. B, the patient is going to be discharged to another facility at midnight. C, the patient is to have nothing to eat or drink after midnight. Or D, the patient is expected to die at midnight. What do you guys think? Yeah, nothing to eat or drink. So that's how you would see the abbreviations on the state exam. And there's not very many of them. There's usually only 1 or 2 that show up, but you do need to kind of be aware of them. Now I've got a whole list of them on page 62 for you. And before you start freaking out, you don't need to know all of them, but there are a few that we probably want to pay a little bit of special attention to. So if you're going down that first column, PRN is something you need to know. So is stat. Stat means now, immediately, don't delay, right? Stat. We just went through all the IDs, BID, TID. Remember, QID is not used. We went through all the Qs, QH, Q2H, Q3H. Those are just the hours. QD is Q day, QAM, QPM. So we went through all of those. But if you go down to the second part of that first column, ad lib, you guys need to know. Ad lib means patient gets to make all the decisions. Ad lib. They can get out of bed, ad lib. They can go to the bathroom, ad lib. They can eat snacks, ad lib. They can leave the facility, ad lib. Just means as they wish. Okay, no restrictions. You also need to know A and O. We want A and O. A and O means alert and oriented. You are A and O. You're alert and you're oriented. You know where you are, when you are, and why you are. Okay. person, place, and time. So we like that. If our patients are confused and they don't know where they are not alert and oriented. They might be alert, but they're not oriented. Good. So that just kind of gives us a pretty good glimpse into the state of mind of our patient. If our patient is comatose, they are not alert. So if you get report and you find out your patients are A&O, woo, those are good days. Now, usually it's called A&O times 3. Now that times 3 gets really confusing for CNAs. Does that mean that we check 3 times? What does that times 3 mean? If you see A&O times 3, it means that they're oriented to person, place, and time. And that's because orientation can affect any one of those 3 or all of them. So they may not be aware of place, but they know who they are and who you are. They just don't know where they are. They may know who you are, who they are, and where they are. They just have no idea the time, what year it is. They think it's 1962. So A&O times 3 means they're alert and oriented to person, place, and time. If any of those are affected, they would tell you and report which ones, or they'll say all, all affected. They're not alert or they're not oriented to any. Okay. Now going down that list, ADLs, we already know that one. What does that mean? And that's what we do. So you probably need to know what ADLs stand for on the state exam, considering it's half of our job. So it probably is going to show up somewhere, right? BMs, that's bowel movement. You need to know that because we're going to track those. And then moving on down, I's and O's. Now we kind of touched on this at one point. Intake and output. This is when we measure everything going into a patient and everything coming out of a patient. We're going to get into that a little bit more in detail today. Wednesday. NPO, we just covered. And PPE, which is personal protective equipment. Those are the ones that you absolutely probably should have a passing awareness of for the state exam because they might show up. And they're all relevant to what we do. Okay. Now you've got more in the second and third column. Those are good to know. They'll make your life easier, but they probably won't show up on the exam. Okay. Other than CNA and RN. I mean, those 2 will show up. But most of the rest of them probably won't show up on the state exam. Now, if you want to learn how to use these abbreviations properly, I've got a whole activity there on page 63 that gives you how those abbreviations would be used and with a line for you to be able to decipher what it means. So it's a really good practical example of how medical abbreviations are used in healthcare. Good? Questions? Does that help you with number 2? With positions? Okay. All right. Any other questions on the state exam or on your homework? Sorry, on your homework. No others? Okay. Tonight you're going to have chapter 7 to do. 7 is another skills chapter. Don't really pay much attention to the skills. We cover those in class. If it's a skill we're not covering in class, you can read through it. But you want to pay attention to the paragraphs in between the skills. That's what you really want to pay attention to for chapter 7. If there's a discrepancy between what I tell you and what the yellow book tells you, who do you listen to? Yep, I'm specific to our test. That is correct. Yellow book is general, watered down, kind of covers everybody, but no real specificity to it. Okay. Good. All right, let's get into today. We are going to learn 4 skills. We are going to learn range of motion, elbow, and wrist. Why is this not working? We are going to learn range of motion, elbow, and wrist. We're going to learn denture care, which is mouth care with an extra step. We're going to learn how to walk a patient, ambulate with a gait belt, which is just walking a patient. Ambulate's a fancy word for walk. We have to learn body mechanics, foot safety, and using a gait belt. And we're going to learn how to give a partial bed bath, which is the longest skill we have. The state exam is going to give you 19 minutes to perform a partial bed bath. Now, I have bathed big people and I've bathed really little people. I've bathed squirmy people and those that just lay there. And I'm going to tell you that none of them take 19 minutes. Okay. They give you lots of time to get this done, but we have to go over our washing rules again because those washing rules are going to apply. And we're going to add one new principle to washing rules for that particular skill. And then you'll have some time to practice today. Okay, good. Questions? There are only 3 classes left after today. It goes fast. It goes fast. All right, so let's go to range of motion, elbow, and wrist on page 55. All right, so let's review what we've learned in class so far because it was a long weekend, right? You may have forgotten a few things. So we performed the skill as directed on we follow the care plan, the whole care plan, and nothing but the care plan. What are we observing for? Changes, abnormalities, anything that stands out to us, anything that makes us go, And who do we report those observations to? The nurse. What is happening here? All right. So every skill starts with the opening. Every opening starts with a knock. How do we know that we're with the right patient? So we're going to either address them by name or ask them to state their name, one or the other. Once we know that we've got the right patient, what do they need to know about us? Okay, so our name and title and why we're there, the name of the skill. Once we have established all of that, what do we need to get, from the patient?
Consent.
Yeah, consent, permission. Absolutely. Once we've got permission, how do we protect the patient's privacy? Close the curtain. What are we going to do immediately after closing that curtain? Wash our hands, because remember that curtain is not clean. Now that we have clean hands, we can go get our clean supplies. But we're going to need a place to put those supplies. So we're going to get a barrier. That barrier is going to provide a clean place to put our clean supplies. Very good. We only want to touch supplies with what kind of hands? Clean hands. Now, this is important. I know this seems like super watered down, right? Super simple. Of course, I know this. Why would you get supplies without washing your hands first? But I'm going to tell you, when you start to practice in just a little while, you're going to forget this. And at least one of you, statistically, is going to go right over to the supply shelf and start getting your supplies without washing your hands or without getting a barrier to put those supplies on. So remember that this is important. You can only touch supplies with clean hands. Now, if you go watch videos on YouTube, just type in any of the skills that we do on YouTube and watch any of them that's not me. Okay, take a different video. You will see that there are many skills videos out there that do not wash their hands before they get supplies. And that is an automatic deduction on the state exam, a serious one. So don't forget how important that step is. Okay. What can we not let our supplies touch? Yeah, our uniform, because it's not clean. And when do we want to get that barrier? Before or after we get our supplies? Before, because we have to have a clean place to put those supplies. Okay. All right, so every skill is going to require that we evaluate whether we need gloves. We're not wearing gloves for absolutely everything, because then we stop paying attention to what we touch, and that puts patients at risk. So that means that every single skill, we've got to stop and think, do I need gloves for this skill? But it goes beyond that. It's not just the skill, it's actually the patient we're going to do that skill on. So when we're going to do a skill and we're getting our supplies, we need to go over 3 rules in our head. Can anybody tell me what those 3 rules are?
The ick factor.
Okay, ooey gooey, the ick factor. Non-intact skin. Okay, that falls under the ick factor. Personal skin, bathing suit skin. Yeah. So if I'm going to go anywhere near those 3, right, body fluids, non-intact skin, or personal skin, then I need some gloves. If the answer is no to all of them, I'm going to wash my hands before and wash my hands after, and I'm good. I'm not putting the patient or myself at risk, because remember, those pathogens need a doorway out, a mode of transmission, and a doorway in to cause infection, right? Good. Okay, I'm not going to wear gloves for everything for the test because they're not going to let me. I have to have a better understanding of infection control than that. If I do need to wear gloves, what is the first thing they should touch? The patient, not the supplies that we're trying to prepare, not the privacy blanket, not the sheets, not everything else in the environment. We want clean gloves for clean patient use. Good. Now, once we've done the skill and we've contaminated our gloves, we have to be careful about what those gloves touch. And then we have to remove those gloves correctly. Okay.
Sorry.
That's okay. All right. So sometimes when we're gathering our supplies, we're going to need a privacy blanket. Now, that privacy blanket is used for 2 reasons. Can anybody tell me the 2 reasons? Keep them warm and protect their privacy. Very good. So we're going to use this if anytime the patient is uncovered or undressed. That's right. So if you're doing a skill and you're thinking to yourself, do I need a privacy blanket for this? I want you to think about the skill and decide, is the patient uncovered or undressed during this skill? If the answer is yes, you need a privacy blanket. Now, when we put the blanket on, what don't we want to do with that blanket? Snap it or shake it. You don't want to cause a vortex to bring up anything that you'll be able to breathe in. And we're going to pull the sheet down underneath the blanket so the patient is always covered. Don't take the sheet down and then put the blanket on. Good. Now, if we use a privacy blanket, when we remove it is actually very important. Because if you remove that blanket with gloves on, you're going to have to touch the sheet that's going to go right up next to the patient's face with those gloves. So we've got to wait until we take our gloves off before we take the privacy blanket off, which usually means it's the very last thing we do before the closing. Good. Okay. So when we're gathering anything to use on the patient, any sort of a linen, whether it's a privacy blanket or washcloths, towels, sheets, clothing, whatever we're going to use, we've got to be careful not to hold it up next to our uniform. And we have to remember that we have to have clean hands to get those linens. We don't want to snap or shake them. So remember, if it shows up twice on, 2 different principles, it's a very important step. Okay. And then we have to remember how we use these linens. So the way that we do that to prevent cross-contamination is clean rolls toward me, dirty rolls away. Very good. Or toward the patient. We don't want anything to touch floor, whether it's clean or dirty, doesn't matter. Nothing that's we're using with the patient touches the floor. And if we don't use it, can we leave it in the room for later? What do we have to do? Lose it. Very good. Very good. Okay. The patient has to always be in the middle of the bed, always. So it doesn't matter whether they're on their back or on their side. At the end of whatever motion we're doing, they have to be in the middle of the bed. So if we're going to turn a patient onto their side, that means we've got to scoot them toward us first and then roll them. Which way are we rolling them? Toward us or away? Away. Very good. We remain behind the patient's behind. Yeah. Back, but any of the B words will work. Okay. And remember, the patient must always be in the middle of the bed. All right. Then we have washing rules. Now we're going to go back over this in a little bit because partial bed bath is a washing skill. So we're going to go over this again, but let's review it just really quickly. What do we not put in the basin? Soap, because we have to have water for rinsing. How do we get water out of the sink? You have to use a paper towel because your hands are clean. If you touch that faucet, whatever you get on your hands, you're taking over to the patient. And that's not cool. What temperature should the water be? Warm, not hot, not cold, just warm. Now, just because I think it's comfortable doesn't mean my patient's going to agree. So who else has to check it? The patient. Very good. Now, this is important. When you're working on a mannequin, and we have 3 washing skills that we're going to do on the mannequin, you're still going to ask the mannequin to check the water temperature. I know she's a mannequin, but we're going to ask her to do that. The evaluator will probably stick their finger in that bucket to find out whether it truly is appropriate. Okay. You treat the mannequin like she's a real person. Good. We're going to talk about leaves method in a minute. Whatever we wash, whatever we rinse, we dry. Don't skip steps. And try not to get your surface wet. We always have to protect our surface. So if we're working on a table, we're going to put a barrier on the table. What side faces up? Absorbent side faces up. If we're working on the bed, then we might want to put a towel down, or you can use a chucks as well. Whatever you happen to have handy will work. Good. And then if we're going to put lotion on, what do we need to do before we put lotion on? Warm it up in our hands. What do we do after we put lotion on? Wipe off the excess. Good.
And when you get your barrier for your table, do you get 2 or do you wait to get it with the other supplies for the bed?
Depends on how good you are at juggling. Because remember, the first barrier you get, you've got to lay it out on the table.
So you can get that one with the supplies.
Right. And that's how I would do it because I'm not very good at juggling. And that means I'm going to hold something against my uniform,
Right.
which is our cardinal rule here.
Do the barrier first, then go back.
It's always best to get your single barrier, put it on the table, then go get the rest of the supplies that you need. Yeah, just remember the hallmark, the important part is that we don't want anything to touch our uniform or, to press against our uniform. That they're looking at that. Right. Like I said, I'm not really good at juggling. Everything is going to be cleaned the same way. We're going to dump it wherever it normally goes, right? Sink, toilet, whatever it normally goes. And then we're going to rinse the basin, right? Now, basin could be a small emesis basin for mouth care, could be a big bath basin for bathing, could be a urinary graduate container, which is what we dump the urine in to measure it. So anything that we have to clean that held something liquid is called a basin. They're all cleaned the same way. Bedpans too, cleaned the same way. So we're going to dump it where it normally goes, rinse it, and that rinse water gets dumped wherever the primary liquid was dumped. So if we're working with a bedpan and we rinse the bedpan, that rinse water should also be put in the toilet. Okay. Then you're going to set that basin down in the sink, and we're not going to touch it. We're going to hands off, because if you have to disinfect it, that's when you would do it. You can't hold it while you're disinfecting. Then we're going to pick it up with a paper towel, because we're assuming that it's been disinfected, and our dirty hands or dirty gloves cannot touch that basin. So we'll pick it up with a paper towel, dry the inside with a paper towel, throw it away, dry the outside with a paper towel, throw it away, and then grab one more for the drawer. Good. So one to pick up your basin, one to dry the inside, one to dry the outside, and one more for the drawer. Good. So basin cleaning, 4 paper towels. Now, the reason that we use a different paper towel for the inside and the outside is because when we disinfect, we only disinfect the inside. And if you take a paper towel and dry the outside and then dry the inside, yeah, the outside wasn't clean. Does that make sense? So that's why we use different paper towels. And then we're going to get to the closing. Closing is at the end of every single skill we do, right? Every skill we do. And there's 6 C's to the closing. The first 4, the order doesn't matter. Can anybody tell me one of those 4? Clean environment. Comfortable. They need to hear that word. Are you comfortable? Call light. They got to have a way of contacting us when we leave. Curtain. Curtain. So clean, comfortable, call light, curtain. Good. Once you get all of that done, go clean your hands. So wash your hands. After you've washed your hands, then you can chart if necessary. There's only 4 skills that require charting. So for the most skills you're going to do, you're just going to say my skill is done. But if charting is required, remember pulse, respirations, feeding, which we'll learn on Wednesday, and emptying the urinary drainage bag, which we'll learn next Monday. Those 4 things require documentation. So you have to have clean hands to document. But what do you have to do after you document? Wash your hands again, because we have to end skill with clean hands. Good? Any questions on that? All right, so let's briefly, and I'm going to fill these in for you. Let's review the skills that we've learned so far. So mouth care. Patient must be sitting fully upright. We're going to protect the clothing. We're going to brush all surfaces and tongue. And we're going to wet the toothbrush before applying toothpaste. We're going to allow the patient to rinse and spit. And we're going to leave the patient's mouth and clothing dry. You guys remember all that from mouth care? You're going to see that again today because we're about to learn denture care. Denture care is mouth care with an extra step. Then we have dressing a resident with a weak arm. Now, when we learn dressing a resident, this is not working today. When we dress a resident, we want to ask about clothing preference or choice. We want to get the clothing before we undress them. Why would that be important? Yeah, we want to minimize their exposure. Remember, you are a stranger. How many of you guys would be completely comfortable being completely naked in front of a complete stranger? Probably not. Even if you're there to help me, I'm going to feel a little awkward about this. Anything that we lift, we always lift from below, support at the joints. We're going to undress strong arm first and dress weak arm first. Remember that using USA first. Undress strong arm first, dress weak arm first. We don't want to overextend or force movements. We're going to adjust the clothing for neatness, make sure all the buttons are buttoned right or snaps are snapped right. It's not all cattywampus, right? We want to make sure the pants are actually over the backside and at the natural waist. You want to make sure the socks, the seam is along the toe, not across this way. So make sure the patient looks good. You want to dispose of items in the hamper. Don't leave them laying around. And we want to put the call light in the stronger hand. Because remember, our patient has a weak arm. The call light in the stronger hand. These are all the checkpoints that you're going to be graded on. Hand and nail care. We're going to support the wrist and arm at all times as we lift it and put it in the basin and on the towel. We're going to soak the hand in water. Whatever we wash, we rinse. Whatever rinse, we dry. We'll place the hand on the towel and use the beveled edge or the slanted edge to clean under the nails, wiping it off in between. We're going to use an emery board to file in one direction toward the center, and we'll apply lotion last. Good. You guys know why we apply lotion last? It's kind of interesting. When you file nails, you actually expel little tiny pieces of nails, so it's like grit, but they can be sharp. If you put lotion on first and then file the nails, it catches those little pieces of nail and it can actually cause irritation to the skin or cause them to scratch because they've got it's like sandpaper. Okay? It holds those little pieces. So you want to apply lotion last. Okay. All right, making an occupied bed. Do you guys realize how much we've learned? Making an occupied bed, we're going to have the patient on their back in the middle of the bed when we change, or I'm sorry, on their side in the middle of the bed when we change the bottom sheet. We'll use that whole scoot and roll thing to get them on their side. We're clean rolls toward me, dirty rolls away. We're going to remain behind the patient's behind as we do this. You want to smooth any wrinkles and make hospital corners. We're going to loosen the sheet over the toes and replace pillowcase with the opening facing away from the door. You guys remember that? We learned how to count respirations. Respirations are always reported over 1 minute and normal is 12 to 20. We don't want to tell the patient we're counting their breathing or respirations. We're going to say start when we start, stop when we stop, so the evaluator counts at the same time. In and out is counted as one full cycle, and we're always going to document this. Anything we count, we write. We also learned how to measure. Where's pulse? Oh, we'll get there. Okay. We also learned how to turn a patient onto their side and keep them there. So we're going to scoot the patient toward us. Closest arm goes, I'm sorry, farthest arm goes up, closest arm goes over, closest knee bent, furthest knee angled, and we're going to roll them away from us or roll them to the opposite side of the bed. Put a pillow behind their back, put a pillow between their knees and ankles, put a pillow under the top arm, and adjust the pillow under their head. And we learned foot care, which was a variation of hand and nail care, just a little lower. So all the same steps, support the foot while moving, wash, rinse, dry. No lotion between the toes. We want to inspect all surfaces. No bare feet on the floor. We'll replace the sock. And we're going to, replace the sock and shoe. And we're going to make sure that everything is secured appropriately. We also learned how to assist a patient with a bedpan for this, for the test. We're going to put the chucks under the patient, then the bedpan. We'll remove the gloves, put the head of the bed up, give the patient toilet paper and call light. When they're done, put the head of the bed back down, take the chucks and bedpan out together because we're going to wrap that chucks over the bedpan. Carry it to the bathroom, dispose of it in the toilet, rinse, dry, and store the basin, and give the patient a hand wipe at the end. Why do they need a hand wipe? Yeah, they just wipe themselves. So we've learned a lot. So I want to remind you, our first skill today is range of motion, elbow and wrist. So page 55. So I want to remind you what range of motion is. Remember that CNAs do exercises to retain function, not regain function. So we're not trying to make anything better. We're just trying to keep whatever they've got going on. So if we get to here and get ow, the next one goes below the ow, and we let the nurse know, hey, the patient said ow. Let them know why, and the nurse will go figure out what to do about that. Flexion extension is an up-down motion. In front, up, down. Abduction, adduction is a side-to-side motion to the side. It works different muscles. Even though the hand gets in the same place, right? Look at where my hand goes, right? The hand is in the same place. At the end, it works different muscles to get it there. So we want to make sure that we're following that care plan and doing whatever exercises it's telling us to. Rotation is an around motion. So rotation of ball joints is a rolling motion. Rolling motion. All right, so page 55. Our care plan tells us to provide the following range of motion exercise to the resident's right elbow and wrist. Flexion, extension, so one exercise. Now the elbow only moves in one direction. If you get an elbow to do anything other than this, you broke it. It's a hinge joint. It only goes up and down. So we're going to extend the arm, bring it up and back down, making sure the elbow is supported like they're making a muscle. Ask any 7-year-old boy to make a muscle. They'll do this. We're going to do that as many times as our care plan tells us to. Now, the wrist can move in all different directions. Wrist can move up and down, but wrist can also move side to side, and it can move around. So we want to follow the care plan. Care plan just says flexion extension, which we know is a up-down movement. So this skill, we do our opening, knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to do some exercises on your right arm. Is that okay? Close curtain, wash hands. We're going to bend the elbow up 3 times, bend the wrist up and down 3 times, and then do our closing. Thank you very much, Miss Jones. Is there anything else I can get for you while I'm here? Are you comfortable? Open the curtain. Your environment's clean. Here's your call light. Wash my hands. My skill is done. That's it. And if you look at the bottom of the page, you'll see that somebody with your level of experience should be able to do this skill in 4 minutes or less. Probably way less. Good. What if you think the patient should probably have all 3 exercises done on their wrist? Okay, so what do we follow? So there was a comment on my Facebook page last week that said on range of motion, this skill is not valid because she did not demonstrate abduction, adduction, and rotation. They missed the whole point that we follow the care plan. We may know how to do other things, but they don't qualify on this patient. Make sense? All right. So I need a volunteer, somebody to go lay down in that bed over there. Anybody? I can show you the video on this, but it's quicker if I just show you in real time.
I was stuck in there. I would have gone.
I know, it's so funny. Every class seems to have like one designated patient. Like, go ahead and lay down for me. It's funny the way that works out. Now I am going to simulate hand washing for the sake of time. Remember, after your first skill, you're going to be told to simulate hand washing during the test. Because where do those evaluators want to be? That's right. That's right. So here we go. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? I am fantastic. I need to do some exercises on your right elbow and wrist. Is that okay? All right, I'm going to close your curtain, go wash my hands, and I'll be right back. I have clean hands. All right, Miss Jones, I'm going to do all the work. All you have to do is let me know if there's any pain or discomfort as we do this, okay? And remember, the care plan said the right elbow and wrist, and I need to do 3 repetitions. So I'm just going to stretch your arm out. We'll leave it supported on the bed. And I'm going to bend your arm up like you're making a muscle and all the way back down to the bed. And we're going to do this 3 times. Any pain? This is 2. 1 more. 3. Good. All right. So now we're going to move on to the wrist. Make sure that elbow is supported on the bed. Don't do this. Okay. I'm going to bend your wrist forward and back like you're revving a motorcycle. We'll do this 3 times. Let me know if there's any pain. So forward, back. There's 1. Good. Forward, back. 2. 1 more. Forward, back. 3. Good. Any pain or discomfort? Are you comfortable? Is there anything else I can get for you while I'm here? Okay, here's your call light. If you need anything at all, let me know. Environment is clean. Open the curtain. Wash my hands. Think about my steps. Make any corrections. I probably would go back and read that care plan 1 more time. And then tell the evaluator my skill is done. Thank you. Good. Good. All right. So let's move on to page 68.
We have that care plan the whole time.
The whole time. So you're going to get,
I'm going to hold on to it.
yep. And you'll have these when you're practicing. That's why they're always up here. Okay. So you'll have this and you will be able to read this at any time. This is exactly word for word what is at the top of your skills page. No curveballs. Now, these in our classroom also have the checkpoints on the back. You won't see that during the test. The evaluator has this, but it gives you an idea while we're practicing what you're going to be checked off. But what you can do to remind yourself of the steps that are required. Turn this just a little bit. Okay, so if I were in here practicing and I was trying to remember how to do something, so let's say that denture care, right? So I would go through here and look for denture care. These need to be reorganized here. Okay, so here's denture care. Along the side here, you guys see this? Shows you all the principles that are going to govern this skill. So I know that I need skill rules. So I would go through here and find my skill rules. I know I'll need the closing too. Now I need linen rules. I know I need barrier. Now I need gloves, opening and skill rules. So if you take this, right, and you lay out each one of these. So there's my skill rules. There's my opening. There's my barrier. There's my glove rules. There's my linen rules. I need basin cleaning. Basin cleaning. Denture care, which is here, and the closing, right? So if I did this and looked at it, these are all of my checkpoints. Every checkpoint that I'm going to be graded on is right there in easy to look at format. Does that make sense? So this is how you use these cards when you're practicing. So if you come over here first, if you decide, okay, I'm going to practice denture care today. If you come over here first and you lay all this out and you physically look, okay, skill rules, I know that. Follow the care plan, the opening, I know how to do that. I need a barrier. I need to use gloves. Linen rules, don't hold them here. Anything I don't use, put away. Denture care, I'm going to read through these because this is the important steps. Basin cleaning, I know how to do that. And the closing. If you go through all that and then go over there and practice, you will do much better. Does that make sense? You will do much better because this is a visual guide to what you need to do. All right. So page 68. I'm really missing my stream deck today. All right, so no, that's not it. There we go. All right, so our care plan at the top of the page says a resident with dentures is sitting at an overbed table with their dentures in a denture cup. So where's your patient gonna be? Sitting in a chair. And where are their dentures? They're not in their mouth. Pay attention to that. Those dentures are not in their mouth. CNAs do not take dentures out and you do not put dentures in. Not your task. Yeah, the patient has to do that. Now, there's a really good reason for this. If the patient can't take their own dentures out or put them in, they don't use dentures. We just puree their food, right? So they don't have to chew a lot. The reason that you don't take dentures out, particularly on the bottom, is dentures are usually held in with denture paste or something that kind of holds them in place. There's wafers they can use, there's paste. Some people have mini implants, which means they clip onto posts, right? So if I have dentures on the bottom and I need to remove them, I'm going to take my fingers and put them all the way in the back and pop up way back here. But when I do that, I'm not putting a lot of pressure on my lower jaw because I'm at the right angle for my own mouth. But if I do that in somebody else's mouth, I'm at a different angle. That means that these knuckles have to press down on their jaw in order to get leverage to pop up on the dentures. When your knuckles are pressing down on that lower jaw, it is possible to dislocate their jaw because you're not aware of how much force you're actively using. Does that make sense? So CNAs don't take dentures out. It's not our job. We also don't put them in. Now, when you put dentures in, your patient will automatically bite down to seat those dentures. It's reflex. Put dentures in. This Halloween, go put a set of hillbilly teeth in, right? If you put those in, you will automatically just go to try to get them in the right place. Well, if you're putting dentures in somebody else's mouth, your fingers are right there where they're going to chomp down on, which means you're probably going to get bit. They're not going to mean to. It's an unconscious reaction. So CNAs don't take dentures out, you don't put them in. And that's actually reflected on our care plan. Our care plan says patients going to be sitting in a chair at an overbed table. Dentures are in a cup. Our job is to clean the dentures so that they can wear them later. That's it. But we also have to clean the mouth they came out of, because that denture paste or wafers is going to hold a lot of food particles up against the gums. So we've got to get the gums clean. So denture care involves cleaning the dentures at the sink and cleaning the mouth they came out of. Good? Questions? Questions? Okay. It says the resident's denture needs to be brushed with toothpaste. That's going to be important in a minute. And the resident needs mouth care. The denture is stored in a denture cup after cleaning. So where are we going to put it? In a denture cup. Are we going to put them in their mouth? No. The resident is not able to provide their own mouth care or denture care. Guys, I'm going to tell you that in most settings, if your patient can clean their own denture, they will. They're not going to trust you with them. Because if you drop those dentures or you break those dentures, it's going to cost several $1,000s to replace them. And the patient's going to be without dentures for several weeks during that process. It would be like me handing you the keys to a Lamborghini that I own and say, have fun. You know, I'm not going to do that. It's not worth the risk to me, because I'm the one that's going to have to suffer the consequences. Does that make sense? So if your patient can take care of their own dentures, they probably will. But if they can't, we need to be aware of the right processes so that we don't break the dentures, so that we keep them safe for the patient's use. This is probably the biggest risk that the patient takes, is dentures and hearing aids. Does that make sense? This is especially important if you're dealing with patients that don't always have the memory capacity, because patients will take, especially dementia patients, will take dentures out of their mouth and leave them in chairs or in the bed or, you know, laying around. So we have to be very, very aware when our dementia patients have dentures and hearing aids. Okay, good. All right, so let me explain to you a little bit about dentures. All right, so there's 3 different types of dentures. This is what we normally think of. This is called a full plate. And that's when we're talking about dentures, that's usually what we're discussing are full plates. This is going to replace every tooth the patient has on either the upper or the lower jaw. And a full plate of dentures is going to look like this. It's not good. Okay, anytime you handle dentures, you must have gloves on. That's a rule. Anytime we handle dentures, we must have gloves on. Another rule is that dentures must be stored in water. Somebody did not pay attention to that rule because I've got dentures in here and not in water. All right, so this is a full plate. It replaced all of the patient's teeth, full plate. This is an upper plate because it has a palate, the part that is going to mold to the top of the roof of the mouth. This is a full plate. But if your patient has good teeth left, we're not going to pull healthy teeth. We would only pull the ones that need to be removed and replace the ones that we pulled. And that would create a partial. So a partial is going to look more like this. This is a bottom plate. Notice there's a cutout for the tongue. See how we have teeth and then we have openings or gaps that would fit around the patient's natural teeth. So full plate replaces everything. Partial replaces some. And then we have bridges, which are little tiny pieces of dentures that would just kind of clip onto teeth that are there and fill in gaps. Now, when we're cleaning dentures, we may have any of the above. You can have full plates, you can have partials, you may have bridges, but whatever the patient has is what we're going to clean. Good? Make sense? Dentures must be stored in cool, clean water. If they're not stored in water, they tend to dry out, become brittle, and more likely to break. Okay. They must be stored in cool, clean water. We're also going to use cool water at the sink when we're cleaning. Now, dentures must be cleaned with running water. So let's go to that slide. Okay, so dentures must be cleaned in running water if we're going to use toothpaste. Now, this care plan told us very specifically to clean the dentures with toothpaste. Very specific. Most denture care people that make the dentures, you know, I don't remember what they're called, but dental technicians, I think is what they're called. They actually make the dentures. This is not the same material as your natural teeth. This is a polymer, like a resin, and it's a man-made material. When you use toothpaste on it, toothpaste is abrasive. You use toothpaste on this material, it's likely to cause small cracks to form. Cracks can harbor bacteria, and we can create some sort of a link in our chain of infection that we don't want. Make sense? So in most cases, our care plan is going to tell us to put our dentures in a denture cup with those fizzy tablets that are designed to break down the proteins and get our dentures clean. And then we just take a soft brush and brush off whatever's left. This care plan tells us to use toothpaste though. So we're going to follow the care plan. How would we know out in the wild which method we're supposed to use? Care plan, absolutely. This is the riskier of the two, cleaning it with toothpaste, because toothpaste is going to make those dentures very slippery and likely to fall while we're cleaning them. And that's why we're demonstrating this for the test, because it's the riskier and they want to make sure that you've got the process down. So during the skill, we're going to put a washcloth in the bottom of the sink to create a softer surface if those dentures should fall. Now, even better if you can get that washcloth over the drain, because that'll let water pool up. And that way, if the denture falls, it's going to hit the water, not the sink. Good? Makes sense? That is a critical step on the state exam. So for this skill, we're going to put a washcloth in the sink. We're going to use cool water. We're going to store the denture in clean water on a barrier after we've cleaned it. The patient must be sitting fully upright for mouth care, and they are, because they're sitting in a chair. We're going to protect the clothing. We're going to brush the teeth. We'll wet all brushes before applying toothpaste. We're going to let the patient rinse and spit, and we're going to leave the resident's face and clothing dry. So you'll notice that most of those steps are what we reviewed from mouth care. What we're adding in here is taking the dentures to the sink, lining the sink with a washcloth. We'll use a paper towel to turn that water on. Always use gloves when you're handling dentures, right? Good. Brush all surfaces of the denture, rinse the cup out, fill it up with cool, clean water, put the dentures back in. We'll store it on a barrier in the cup for later. Now, for the test, we're going to use 2 new supplies. This is a denture brush. It is a double-sided toothbrush. This side is small and fits in the groove or the channel of the denture, so it can get that paste out. This side looks like a toothbrush. We're going to use it on the teeth part of the dentures. So channel, teeth. This is a toothette, also known as an oral swab. I told you in healthcare, we have multiple names for everything. This is an oral swab. It looks like a lollipop, but it really doesn't taste like one. But it's soft and spongy. Now, we use this for mouth care when we're doing denture care, the mouth care part. And the reason is if we use a brush in the patient's mouth, remember that the mouth is going to have that denture paste and food particles. If you use a brush, the paste is going to get all bound up in that brush. And by the time you're halfway done, the brush is kind of unusable because it's got all kinds of gunk in it. Using this is a solid surface. It's spongy, but it's solid. So it lets us swipe away the denture paste and the food particles and then turn it. And then swipe again and then turn it. It gives us 4 surfaces to work with. So top, bottom, top, bottom. Good? Makes sense? This is disposable. We toss it when we're done. When we treat it just like a regular toothbrush, we're going to wet it first, put some toothpaste on it, and go to town. Okay, good. Questions? Denture care, and I do have dentures here for you guys to play with. Please don't break them. Our supply kits now. Show you the supply kit. Somebody was asking about it last week. So these are our supply kits. And those of you that are joining us from YouTube world, you really need one of these. These guys get to practice in the lab today. So they're going to be, all of these supplies are available to them. But if you're at home, you probably don't have these supplies available to you. But this practice kit contains everything you need to practice. You have the Basin, you have the Gait belt, which we're going to use in a few minutes. You got a food tray, soap, lotion, drainage bag, chucks. You have bedpan. And then in here, we have emesis basin, gloves, toothbrush, toothette, denture brush, all kinds of stuff. So it's everything you need to practice. And what we are now have, which I don't have in this kit, but we are now including are dentures to practice with. They're pretend dentures, they're play dentures. You can't actually use them, but it has a groove in it, just like regular dentures. So it allows you to practice denture care. And it comes in this nice carrying bag. So those of you joining us from YouTube world, you want to put this in your budget. Those of you here, you've got supplies here to practice with. But if you're not able to stay here and practice with our supplies, and you're only going to be practicing at home, this is something that you probably want to invest in. And these are on that paper that I gave you on the first day. We give a significant discount to you guys in class on these. I think it's only $45.99 while you're enrolled. And then online, you'll see it's like $65.99. All right. Any questions on denture care? I'm going to show you this video because it has good close-ups, especially of washing the dentures at the sink.
Hello,
Hi, Mr. Jones. My name is Patti. I'm your CNA today. How are you?
I'm doing good. How about yourself?
Wonderful. I need to do denture care on you. Is that okay?
Yes.
I'm gonna take your dentures to the sink. I'm gonna close the privacy curtain and wash my hands. I'll be right back.
Okay.
Okay, Mr. Jones. I'm gonna place the barrier on the table, so we have a clean area to place the clean supplies. And then I'll gather the supplies in. We'll need a cup of water, a toothpick, a denture brush, toothpaste, a basin, a washcloth and a towel, and 2 sets of gloves. Okay, we're gonna get the denture brush ready for use, so I'll wet it. And apply a little bit of toothpaste to both sides. We'll allow the basin to hold that denture brush until we're ready to use it. I'll be right back, Mrs. Jones. I'm going to go clean your dentures.
Okay.
Okay, Mr. Jones, I'm just gonna set your dentures over here, so that you have them, you can need them later.
Okay.
I'll place the denture brush on the barrier, and now we'll remove these gloves. I'll throw those away. Do you mind if I place a towel over your chest? Super. Just to help keep your clothing clean. We're gonna prepare for the mouth care portion of this skill. We'll take the toothpick and wet it. Apply a little bit of toothpaste to one area of the toothpick, and apply gloves. Okay, Mr. Jones, I'm gonna brush all surfaces of your teeth now. So in a moment, I'll need you to open your mouth wide so that I can reach the back teeth.
Okay.
Okay, can you open your mouth? Thank you. I'm gonna brush the back on the bottom and on the top, both sides. Okay, can you bring your teeth together, please? Thank you very much. I'm gonna throw the tooth out away. Would you like to rinse? Good. Would you like another rinse? Another rinse? Okay. I'm gonna remove your towel and we'll place this in dirty linen. We'll throw away the disposables. And now I'm going to clean your basin. I'll be right back. Okay. I'll place the denture brush and the toothpaste in the basin and open the door with a paper towel. Store the base in another 2 months. I'll remove the barrier from the table. And we'll throw this away as well. Now I can remove my gloves. Mr. Jones, are you comfortable?
Yes, ma'am.
Can I get you a magazine?
No, thank you.
Is there anything else that you need?
No, thank you.
Your call light's right there. If you should need anything, just let me know. I'm going to open your curtain and go wash my hands. After washing my hands, I'll think about the steps in my skill, make any corrections, and then tell the evaluator my skill is done. All right, any questions on denture care? Questions on denture care? You'll have an opportunity to practice that in just a little bit. We have 2 more skills to learn. And they're gonna take us right up until about 12, maybe just a few minutes after, but you should have at least 45 minutes of practice today. Let's go ahead and take our break, come back in 15 minutes, so at 10 till. Thanks. guys, make sure you stick around until the end today because I've got a gift for you.
All right, so go ahead and turn in your skills books, page 46. Gianna got 190. 190. Patricia got 100. Thank you guys for your scores. I appreciate it. Sorry you're having issues, Gianna. I hope I'm not frozen and I hope the sound works. We were on break, so it might have been what you were seeing is we were on break. And we're back now. All right. So page 46, you've got ambulate a resident with a gait belt. This care plan says ambulate the resident at least 10 steps. How far are we going? Yeah, guys, it's 5 steps in one direction, turn around, and 5 steps back. So we're not going very far at all. It says use a gait belt or transfer belt. Again, same item, 2 names. We're really good at that in healthcare. So gait belt, transfer belt, same thing. Patient will be sitting in a chair at the side of the bed with shoes on. Patient is able to walk but needs assistance to stand. So when we get that with shoes on thing, that's because we have shoe rules. And that's the last principle we have to learn. So after this, you will have all principles covered. So let's learn shoe rules. So like everything else that we learn here, these are common steps that are going to be seen in several skills, things, words to live by, basically. And one of the first one, or one of the most important ones is the first one on this list. If the patient's feet hit the floor, we have to talk about their shoes. Slippers, socks are not enough. How many of you guys have ever been a patient at a hospital? Yeah, they probably gave you one of those patient gowns to wear and some slipper socks to put on that have the dots to keep you from slipping and falling. And we walk all around with those slipper socks on and we don't ever think about it, but we probably should. You know, I've been in our local hospital down the road here and there's a Subway in the lobby, and I've actually seen patients in the Subway in their gowns and slipper socks getting something to eat. And then they walk back through the hospital upstairs and climb into bed with those slipper socks on. What climbed into bed with them?
Everything.
Pathogens. Now, if this person has an incision somewhere, incisions are warm, dark, moist places. And when you bring pathogens into bed, as you move around in the bed, you know, stretch your legs out, curl them up, kick the covers off, those pathogens are going to move throughout that bed because your legs are the mode of transmission. So that's probably not a good strategy to prevent infections, right? When we're working with patients, they really should not have their feet on the floor without shoes. If the patient doesn't have shoes, let the nurse know, because we have ways of solving problems. If the patient came from home and doesn't have shoes on, we can call up home and say, hey, bring them some shoes. If the patient came from a facility and they don't have shoes, we can call up the facility. Hey, we need shoes. If the patient is homeless and has no shoes, we can call up a social worker and say, hey, this guy is going to need some shoes. And they have resources to be able to get the patient what they need, because we can't discharge them without shoes. Make sense? So we've got to make sure that our patients' needs are being taken care of, but we also have to think about infection control as well. If you absolutely positively do not have any shoes anywhere that we can use, put a second set of socks on that we can remove once they get back into bed to help prevent this infection control nightmare. But that's not going to be the case for the test. The test, the patient sitting in a chair at the bedside, and they already have shoes on. Your responsibility is to make sure that you say something about those shoes. We need to let the evaluators know that we know shoes are important. So I see you have shoes on. Do your shoes fit well? Are your shoes fastened appropriately? Any of those will work, but you have to address the shoes. So if the patient's feet hit the floor, we talk about their shoes. Good? Questions? Shoes also help prevent injury. There are sharp objects in healthcare. We use needles and lancets and glass bottles and all kinds of sharp things. And it's possible that some of those might fall on the floor from time to time. Would you let a toddler walk around barefoot in a hospital? If we wouldn't let a toddler do it, then why are we letting our patients? Patients are just as valuable as toddlers. And they need to be protected just as much. And they may not be aware of all the dangers. You probably weren't aware of all the dangers 3 minutes ago. So it's our job to make sure that we're keeping them safe. Does that make sense? All right. So once we know that we've got shoes and we've talked about shoes and everything is good in the world with shoes, then we're going to move on to gait belts. So a gait belt is nothing more, it's a fancy name, but it's nothing more than a flat canvas belt. That's all it is. It's canvas so that it kind of squishes, right? So it's not hard and rigid. Like if we use a leather belt, leather belts are kind of hard and rigid and they might injure the patient. This is a little bit softer and squishier, so it's less likely to injure the patient, but canvas is very strong. Like you can't break this. Okay, so all the strength of leather, but in a softer format. So a gait belt is a belt that's going to go around the patient's waist. That's important. You will see healthcare workers wearing this as they're working. They're just storing it around their waist. It's not serving any purpose. They're just wearing it to carry it. Good. So when you're putting this on the patient, remember it goes around the patient's waist. It does not go around their chest. It goes around their natural waist. And when you put it on, it doesn't matter whether the buckle is facing this way or the buckle is facing this way. Nobody cares. What matters is that the tag, like every other article of clothing, goes in. So not tag out, tag in. Doesn't matter whether it goes this way or this way. When you put this around the patient's waist, you want to make sure that it's flat and not twisted. So see how that's flat and not twisted? If it were like this, it could injure the patient. So we want to make sure it's flat and not twisted. Once you get this around the patient's waist, you're going to put the free end through the first guard by the alligator teeth. So this is going to go right through there. Right through there. by the alligator teeth. Those teeth tell you which direction to pull this to tighten it. See how all those teeth are pointing that way? That means we're going to pull it that way. If I try to pull it this way, it's not going to do anything. We want to pull it this way, and we want to get it snug. If this isn't snug enough, when we go to lift the patient with this belt, it's going to go up, either underneath the breasts or under the arms, or the patient will slide right out of it. So we need this secure enough to stick. So you want to tighten it up until you can just fit 4 fingers between the belt and the patient, just 4, not 4 this way, just 4. Okay. You need it snug. Now we get skinnier when we stand. So you're putting this on with the patient sitting. When the patient stands up, their torso elongates, and that's going to make this looser. If it's too loose when you put it on and you stand them up, it's not going to be effective as we're walking. Okay. So 4 fingers between the belt and the patient. Then you're going to put the free end through the second guard right here to lock it in place. Now, if this tail is hanging down in your way, you can just tuck it up inside the belt. That gets it out of the way. Okay. When we remove a gait belt, we're going to reverse the process. We're going to take it out of the belt, out through the second guard. But now to get, we can't pull it this way because remember, those teeth are going to bite into it. So what we're going to do is hold this tail with one hand and slide the buckle along the tail to remove it. When you remove the gait belt, don't slide it against the skin. Listen, you guys hear that? That's going to burn the skin. So we don't want to do that. When we remove the gait belt, we either take both of our hands behind the patient, or you can loop the gait belt up and over. Keep the buckle in your hand so it doesn't bunk them up the head, upside the head. Okay. But don't slide it against the skin. Good. Questions? All right, so that's how we use the gait belt. Feet must be flat on floor before we lift the patient. Well, that just makes sense, but there's a problem here that you probably haven't thought about because most people have longer legs than I do. When I was a little kid, I used to pray for legs. I should have been more specific. I wanted length, not width. The problem is I have short legs. So if I'm sitting here and I've got my backside all the way to the back of the chair, my feet do not rest flat on the ground. They actually, I have to be up on my tiptoes. So if you try to lift me to a standing position from here, I'm going to fall because my weight is not evenly balanced. So if you're going to stand me up, my feet need to be flat on the floor first. So you would ask me, are your feet flat on the floor? And I'm going to say, no. So I need to slide forward on the chair to get my feet flat on the floor before you lift. That's an important step. Good. Questions? Okay. Now, we've got a patient sitting in a chair. They've got shoes on, and we've acknowledged that. We put the gait belt around the waist with the tag facing in, secured it so we can only fit 4 fingers. And we've asked the patient, are your feet flat on the floor? So we're ready. We're ready. Now we're going to grasp the gait belt as far around the back as we can. If we're working with the little person, you can probably get your hands all the way back here. If you're working with a bigger person, your hands may be more along the sides, and that's okay. You just don't want your hands in the front. It has to be sides or back. And when we're going to lift the patient, we're going to put both of our hands on that gait belt and we're going to count to 3. 1, 2, 3. And as we get to 3, we're going to help the patient stand. Counting is mandatory because we're helping the patient. We're not doing it for them. We're helping them. If you're not counting till 3, they have no idea when you're about to stand them up and they can't participate. it causes a lot of falls because patients weren't quite ready. Good. Questions so far? All right, let's talk body mechanics. After we stand them up, we're going to ask if they're dizzy. We'll come back to that in a few minutes here. So one of the things that we need to do for this skill is remove obstacles. For the test, they're going to have a patient sitting in the chair, and they're going to take one of these overbed tables, and they're going to move it into a position. So if I have a patient sitting in the chair and you're going to do this skill, I'm going to tell you, I want you to walk to that white table and back. That is in your way. They want to see what you're planning on doing about it. So the whole goal here is to evaluate your environment for obstacles before you stand the patient up. Because if you get the patient standing and you go, oh, I'm sorry, hold on a minute, let me leave you and go move that, that could be a danger to the patient. So one of the things that you have to do for this skill is look around your environment for obstacles before you stand the patient up. Make sense? All right, so let's talk about body mechanics. Now, it used to be years ago that we taught healthcare workers to stand in front of a patient when we lifted them to a standing position. So if I'm the patient sitting here, all right, you at home probably aren't going to be able to see this all that well, but if you look on the floor, there's lines. You can see the lines going this way, but there's lines going this way as well. So if I'm the patient sitting here in this chair, you can actually see the lines that create a box. I'm sitting in a box. I've got a line on this side, a line on this side, and one in front of my feet. We're going to use that box for body mechanics. So it used to be when a patient was sitting, we stood in front of that patient toe to toe, knee to knee. So if I've got a patient sitting here and I'm standing here, toe to toe, knee to knee, and I'm lifting their body weight up, all of their body weight is coming back toward me. Now, there's a physics principle here. Every action has an equal and opposite reaction. So equal body weight, opposite direction. So if I'm lifting a 150-pound person up, that means 150 pounds of force is trying to push me backwards. My back has to absorb that. It doesn't take long to realize that your back is going to be injured as a CNA if you use that process, especially if you're trying to lift somebody heavier than you. Does that make sense? That's not a good process. So we have to have something a little bit new, and that's what this is. So if you take that box, remember I've got a line on each side of my chair and a line in front. If I put one foot parallel to the chair, so like this, the other foot perpendicular or across their feet like this, I am now standing at the corner of that box, 1 foot along each side. I'm going to bend at the knees, never the back. I want to save my back. So I'm going to bend at the knees like this, reach around behind the gait belt, and we're going to lift that patient up. And when we lift the patient up, we're going to take a step back, and that keeps me stable. I don't have all of that weight trying to force me backwards, and I am way more stable using this method than the toe-to-toe. So fewer injuries and less falls. Sounds like a win-win to me. Okay. Now, when we lift a patient to a standing position, You go back a page to 45. At the top of the second column, you're going to see a picture. Do you see how that patient's arms are down at their side? Look at where their shoulders are when that person is trying to lift them. Do you see how the shoulders are doing this? This is going to pull the patient off balance. This is not a safe position when you're trying to lift a patient. What we want is their entire trunk to be moved as a unit. So to do that, we're going to ask them to put their hands on our shoulders so that when we lift, their entire trunk stays in alignment and their shoulders don't drag back. Okay. So this is what you should look like when you're going to stand a patient. 1 foot across their feet so they don't slide out, 1 foot parallel to their body. So you're standing at the corner of that box. Gait belt around the patient's waist, snug. Their hands on your shoulders. And on the count of 3, 1, 2, 3, we're going to stand. Now, once we get them standing, we want to ask, are you dizzy? I don't want to wait until I'm way over there to find out if my patient is dizzy. What is my exit strategy? I don't have one. I'm in trouble. So when you stand a patient up, you need to ask, you feeling okay? Are you dizzy? Everything good? Then we can go walk. Good. That's kind of important. But let's talk about falls for a second. Now, I've been a nurse for a very long time. I've had my share of patients that have fallen over my career when being walked by CNAs. And universally, I hear this. We were just walking along. I don't know what happened. Next thing I know, she's on the ground. Okay, that tells me you weren't paying attention because patients don't just walk along. I'm good. I'm good. I'm good. Ugh. It doesn't happen like that. Patients give you signs that something is very wrong in their life. They get very pale, sweaty. They may put a hand out for stability, slow down, start to sway, put a hand to their head or their stomach. They give signs that something is very wrong. If you aren't paying attention to those signs, the patient's going to fall. Now, the problem is that if a CNA sees those signs, the first thing they want to do is rush that patient back to the chair, back to safety. Guys, they're not tolerating a slow walk. You really want to rush them somewhere? You're not going to get 2 feet. They can't tolerate a walk. You're trying to save yourself, not your patient. Wrong focus. So if you've got a patient that has any one of these signs, pale, sweaty, hand out, head, stomach, start to wobble, slows down, anything that leads you to think something's not quite right here, get the patient sitting on the floor. Because if the patient is sitting on the floor, they can't fall on the floor. Sitting doesn't cause injury, falls do. So what I would do, as I'm walking the patient, I'm always slightly behind and to one side. So my patient is here. My focus is not on my phone. It's not on my coworkers. It's not on other patients at the end of the hallway. My focus is 100% right here. I've got an underhand grip on that gait belt. So if they get all wobbly, I'm going to know it. And I'm paying attention to all of my clues. So as we're walking, they're setting the pace. Things get a little squirrely. I'm going to take this leg and put it right here in between theirs. Other hand grabs the gait belt and I pull them against me. And then I can just slide them right down to the floor without any injury. And then I'm going to go find somebody to help. Ideally, I'm going to stay with the patient and go tell you, go get me a nurse. Rarely are we ever truly alone. So use the other staff members. Usually in a hospital or a nursing home, everybody is within shouting distance of the nurse's station. Everybody. And if necessary, I can shout really loud. Okay, but you got to get some help. I really don't want to leave the patient. If I absolutely have to leave the patient to go get help, I'm going to try to get another patient or somebody around. Just don't let him up. Just keep your eye out. I'll be right back. Let me get a nurse. But most of us have a phone right in our pocket. Even our own cell phones. I can pick up the phone and call the facility and say, get me to the nurse's station. You have options. It's not like the old days where we didn't have cell phones. We had pagers. That wasn't helpful. Now we have access to other staff members at the touch of a button. Make sense? So if you see a state exam question that might say you're assigned to ambulate a patient and you notice they become pale and sweaty and reach out for the wall, what is your first action? A, call 911. B, go get a wheelchair. C, assist the patient to the floor and get a nurse. Or D, rush the patient back to their room. Always. Does that make sense? Yeah, you guys probably would have gotten that question wrong before this lecture. Because our instinct is to get them back to safety. But we don't really think about things from their point of view. We're thinking about it from ours. Good. Now, this is super important for those of you who are going to go to work in a med-surg floor or a rehab center, because patients after surgery have fluid shifts. And it's very common to get somebody standing up and, yeah, I feel okay, but they get 5 feet away and they get all of a sudden really weak because of a fluid shift. So we need to be aware of this. Okay, good. So in a med-surg setting, like right after surgery, you probably want that patient to stand just a little bit longer before we go walking. Where normally I'd stand you up and say, hey, you feel okay? You say, yes, we go off. If I'm working with surgery patients, I'm going to stand you up, say, you okay? You're going to say, yeah, and I'm going to wait. Still okay? Let's give it a couple minutes. Let's see how we're doing. Okay, good. Same thing with cardiac patients. Cardiac patients go bad during ambulation quite a bit. They get really, not dizzy, but just unsteady. Okay, so pay real close attention to them as well. All right. So here are our rules for ambulating the gait belt. And again, you can find these in the packet here. So we're going to apply the gait belt while the patient is sitting. We're going to put the gait belt around the patient's waist over their clothing. We're going to help them to stand by holding onto the gait belt around both sides or back. We're going to let the patient leave. We're going to walk slightly behind and to one side, holding the belt underhand. We'll ask them how they feel. And we're going to assist the patient when standing and sitting. And we're not going to pull the gait belt off across the skin. So let's talk about this one real quick. I showed you how to help a patient when we're standing them up, right? 1 foot in front, 1 foot beside, holding the gait belt, hands on the shoulders. We talked about that. When we help somebody sit, we're going to do the exact same thing. Hands on the shoulders, my hands holding the gait belt, 1 foot in front, 1 foot beside. All of that is the same. The difference is that when we're going to help somebody sit, they need to know the chair is there. So if you walk me to this chair and you have me turn around and then you're going to help me sit, what's going to happen when I sit? Why? Yeah, chair's not behind me. Do I know that? No, because I'm not facing the chair. I have no idea it's there. That has happened to almost every single one of your patients at one point. So when you try to sit them, they're going to get all stiff on you and all non-compliant. We like that word, non-compliant. There's no such thing as a non-compliant patient. So what we have to do is make sure that they know the chair is behind them. So I'm going to ask them, can you back up to that chair so you feel it behind your knees? Oh, okay. Now we can sit. Never, ever ask a patient to sit somewhere if they cannot feel the chair. Number one, they're going to fall. But number two, that will make them difficult to work with later because they're afraid and they have every right to be afraid. Good. So we're going to help them stand and sit. Questions? What's that? Oh, do you need to go? Okay. No problem. You're welcome. All right, so let me get a volunteer. Come sit in this chair and I will show you this skill. All right. So those of you at home, this might be hard to kind of watch because I'm going to be moving around the room. Watch the video for this. The video, please put the video up on the screen for them, or the link to the video. Here we go. For the test, real quick, this is something I should have gone over with you. For the test, the care plan specifically tells us that the patient is sitting in a chair at the bedside. So this chair would actually be right next to the bed. Now I've moved it out a little bit so you guys can see a little bit better. But remember, at the end of the skill, we're going to pretend that they can reach the call light because we're pretending that they're closer to the bed. Good. Here we go. Hi, Miss Jones. My name is Patty. I'm your CNA today. How are you? Fantastic. Do you feel like going for a little walk? Okay. Let me go close the curtain, wash my hands, get my supplies, and I'll be right back. This is in my way, so I'm just going to move it out of the way before we get started. All right, so I am closing the curtain. I have clean hands. I'm going to get my gait belt from storage. And I see you have shoes on. Are they fastened properly? Good. I'm going to put this around your waist. This is going to help me lift you to a standing position and provide a little stability while we walk, okay? So I'm just going to slide this behind you, making sure that it's flat. We're going to put it through the first guard by the alligator teeth, and we're going to pull it so that it's snug. I'm going to check it with 4 fingers. I'm going to lock it in and just tuck that tail. Can you bring your feet together, and are your feet flat on the floor? Okay, you're going to put your hands on my shoulders. I'm going to reach around to the back of the gait belt. On the count of 3, we're going to stand, and then we're just going to stand there for a second to make sure everything's okay. All right, go ahead and put your hands up here. 1, 2, 3. Feel okay? Dizzy at all? Okay. We're going to have you walk to that table. You lead at your pace. Remember, for the test, you are you. Not a 90-year-old. You are you. So go ahead and walk. I'm walking slightly behind into one side with my hand underneath the gait belt. Go ahead and turn around. And then we're going to walk back to the chair. Okay. When you get to the chair, turn around and back up so your knees hit the chair. Can you feel the chair? Okay, you're going to put your hands back up here. I'm going to help you sit. 1, 2, 3. We're going to remove the gait belt. I'm going to loop it up. Thank you. Are you comfortable?
Yes.
Is there anything else I can get for you while I'm here? Would you like a magazine before I go? Okay, your environment's clean. Let me get your call light for you. Okay, so the call light is right here. We're going to pretend you can reach it. I'm going to put the gait belt back. Open my privacy curtain. Wash my hands. Think about my skill. Probably read the care plan again. and tell the evaluator my skill is done. Thank you. Questions? We're doing really good on time, so you should have quite a bit of practice time today. All right, let's go to page 88, 86, sorry, 86. How do we know what to do with each patient? And boy, is this a care plan. Okay, our care plan here tells us give the resident a partial bed bath and back rub. Wash the resident's face, neck, chest, abdomen, back, one arm and hand. What if the patient has two? Yeah, we don't care. With soap and water. Provide a brief back rub with lotion. We're not massage therapists. We don't deep tissue anything. This is just to promote circulation and make the patient feel better. Dress the resident in a hospital gown. Patient is lying on back and center of bed and can roll as directed, but is too weak to assist with bathing. If you look at the bottom of the page, you'll see this is being done on a mannequin. This is a mannequin skill. We're going to treat the mannequin like she's a real person. Okay. The problem is that mannequins don't stay on their side by themselves. So I need to turn the patient on their side to wash, rinse, dry the back, and give them a back rub. So remember, patients always have to be in the middle of the bed. So I'm going to scoot the patient toward me and roll them up on their side to wash, rinse, and dry the back. But if I let go of the mannequin, she's going to come back. So that doesn't really help. For the test, the evaluator is going to be standing on the other side of the bed. When you turn the patient on their side, the evaluator is just going to reach over and hold that mannequin. You won't have to ask them to do it. They're only doing it because it's a mannequin. You don't need another person for a real life. I can put you on your side. You'll stay there, right? This is because it's a big Barbie doll. Barbie dolls do not stay on their sides. Good? Make sense? Okay. She also looks like she has a broken neck. All right. So this care plan is very detailed. It tells you everything to wash. But trying to memorize all this, there's a lot of little pieces there. So the easy way to remember, face to waist, front and back. Face to waist, front and back, one arm and hand. And you see that in the middle of page 86. And we're going to we're going to wash the face first, but no soap on the face. Soap stings the eyes, dries the skin. So water only on the face. Then we'll dry the face because whatever we rinse, we dry. And then we're going to wash from the neck down, one arm and hand. Whatever we wash, we rinse. Whatever we rinse, we dry. So nothing really earth-shattering here. We'll turn the patient over. We're going to wash, rinse, dry the back, warm the lotion up, give them a little back rub, wipe off the excess. That's pretty much it. It does tell us that the patient needs to be in a clean gown after bathing. Well, that makes sense. When we get out of the shower, we usually put on clean clothes. It makes sense. Well, there's two different ways of doing that, though. You can bathe the entire patient front and back and then put the gown on. That's probably that's our default. It's kind of the way we think about it. But the problem with that is that if I take that gown off, right, I put a privacy blanket on, I take the gown off, I wash the front, I rinse the front, I dry the front, I turn the patient over, I wash, rinse, dry the back. I have to turn them back onto their back to put the gown on. And then I got to turn them back onto their side to tie the gown. Then I got to put them back on their back. That's a lot of steps. And if your patient has an energy deficit, this could be really difficult. So it's better to clean the front, wash, rinse, dry, put the new gown on, turn them on their side, wash, rinse, dry the back, and just tie the gown. Saves time and it saves energy with the patient. Well, why would energy be a problem? Well, if you turn to page 43, I want to talk to you about energy. You guys ever seen a 2-year-old? Ever seen a 2-year-old? Oh, they're adorable creatures. Absolutely adorable. But they have got energy for days. A 2-year-old will jump up and down for no reason. No reason. They just got excess energy. They will jump up and. When was the last time you jumped up and down for no reason? Now, if I win the lottery, I'm jumping up and down. But I got a reason. And it's probably going to be really short-lived, right? But 2-year-olds, man, they just have energy off the charts. But what we don't realize is your energy actually peaks at around 2. And I'll prove it to you. Put a 12-year-old in charge of that 2-year-old for one afternoon. Who wins? Every time. That 12-year-old's going to be, Mom, can't you make her take a nap? Right? So just in that 10-year period, guys, your energy levels have dropped. Now, 12-year-olds still have way more energy than I have, way off the charts more energy than I have. But it doesn't stay that high. Let's go out to 22. Now, 22-year-olds still have energy to spare. They can shop till they drop and go out at night looking fabulous, right? Still lots of energy, but not as much as you had when you were 12. Let's go out to 42. Now, 42-year-olds, they're shopping till they drop, but that's at like 3 and we aren't going out tonight. Okay. So we've lost energy. Now go out to 62. Now, 62, we're probably putting up our feet for 10 minutes after work before we make dinner because we just need some recoup time. We're thinking about retirement because there's just not enough energy to do everything that we have to do with work and home. So we're thinking about slowing down because our energy levels have dropped even further. Now, what do you think they're going to be like at 82? Right. Some of them, I knew a woman that was 96 years old, my best friend's husband's grandmother. I know it's a little convoluted, but she was 96 years old. She babysat her great grandson every day. She did all the grocery shopping. She still drove. She was active in her community and in her church, and she organized. I mean, just it was this woman I wanted her energy, and she was 96, right? But that's kind of an outlier. So we have to remember that everybody's a little bit different. So if we understand that energy levels tend to decline during the aging process, we have to start thinking about how that's going to affect the patients. So what are some things you do every day that take energy? I mean, so why are we even talking about this, right? Because they're old. Like they have nothing to do and all day to do it. What do we care? What are some things you do that take energy? What's that? Cooking takes energy. Yeah. There are nights that I'm like, I don't want to cook. I just don't want to. What else do we do to take energy? Showering. Have you ever been too tired to shower? If you've been too tired to fill in the blank, that means it takes energy. You've probably been too tired to eat. I know I've been too tired to talk. Right? Those are all things that take energy. But other things, things like breathing take energy. We don't really think about that, but breathing takes energy. And if you've ever had a cold, you know just how much energy breathing takes when you can't do it. So things that we don't even think about take energy. For me, My biggest energy drain every day is getting out of bed. I like my bed. It is comfy and warm, and I got my little puppy snuggler, and I love bed. When my alarm goes off and I have to get out of it, I'm grumbly because half of my energy is going to get in my butt out of bed. So we have to think about all the things we do every day that take energy. And most of those things are still being done by the elderly, even though they have way smaller energy levels. So how would that affect them? Well, if they're using up all of their energy by trying to get up out of a chair without help. Have you ever seen an old person try to get up out of a chair? It's like a rock and roll method, right? Before rock and roll was popular, right? They start doing this. Start rocking momentum. And then they try, no. Hold on. Do it again. You guys ever see that? How much energy did that take? Yeah, it took a whole lot more to do that than if I used a gait belt to help my patient stand. So what I'm going to do is use some of my strength to help offset their energy deficit. Because strength and energy always has an inverse relationship. So the stronger you are, the less energy it takes to do something. The weaker you are, the more energy it takes. So if we've only got this much energy to get through the day, and we have to get up out of the chair every time we want to go to the bathroom and get something to eat and go to an activity, by 2 o'clock, we may not have any energy left. Well, how would that affect us? Well, we need energy to eat. So are they eating dinner? Probably not. They probably pick at it. They're probably not going to make it to the bathroom because they don't have enough energy. So that makes them incontinent. And that can affect their psychological well-being, how they see themselves. They may not want to socialize because talking takes energy. And that can affect their mental well-being because we're social creatures. So a lack of energy can have really big consequences on our patients. And we have to be aware of that. So everything that we can do to help our patients conserve energy is a good thing. So when we're talking about partial bed baths, if you turn the patient over, wash and dry their back, you turn them back onto their back to put a gown on, you turn them back onto their side to tie the gown, you put them back. That's a whole lot of moving. And even when somebody else is doing the moving, it's still taking energy from them. Does that make sense? Now, this is kind of dangerous for young people, because you've never experienced the lack of energy that they have. And I'll give you a good example. Try to explain to that 2-year-old why you can't play, that you don't have the energy to play. Go ahead. Try to explain, try to get them to get it. They're not going to. They don't get it because they've never experienced that. They think in their minds, everybody has the same energy levels they do because they've never experienced anything any different, right? Well, when you're talking to an elderly person and they say, oh, honey, I am too tired for that shower. I just can't do it. And you're thinking, all you do is sit in the shower chair. I do all the work here. What do you mean you don't have the energy for that? We tend to steamroll our patients because we are the 2-year-old. We can't get that they don't have the energy. We just don't get it. If they say, I don't have the energy, they mean they don't have the energy. They can't go to the store and buy it. I don't care what Red Bull wants you to believe. Right? It's just not there. So we need to be empathetic and accommodating. Maybe a bed bath might be a better option. Let me go check with the nurse. This is a change. I have to report the change. So we're going to see what the nurse says about accommodating that change. Good? Makes sense? Now, we also have to think about things like habits and routines. I am a morning shower person. I have to have a morning shower to get me running. Now, there's others that are evening shower people. They prefer their showers in the evening before they go to bed. It's nice and relaxing for them. You fall in one of those two camps, most likely. Or you might be a no shower person. I don't know. But you have preferences. Now, in a facility, if we make entire A wing all morning shower people, I guarantee you there's a few people in A wing that are not morning shower people. So when they say to you, I don't have the energy for that, we might want to report that to the nurse. Make sense? We also have things called circadian rhythms. Now, circadian rhythms really kind of help define your daytime routines. So when you go to bed, when you wake up, how productive you are at what hours, that's your circadian rhythm. I am an afternoon night person. I usually come alive around 4. You're not getting the best me at this time in the morning. I come alive around 4. That's when I'm most productive. Between 4 and 10, I am insanely productive. Anything before 4, I'm kind of playing at it because that's not my circadian rhythm. I do best going to sleep around 1 or 2 o'clock in the morning, waking up around 9 or 10. No, I'm old. You think these habits are going to change? If they were, they would have changed years ago. I'm pretty much set in my ways. So if you come into my room at 4 o'clock in the morning and tell me I've got to get up, I'm probably throwing something at you because I just got into a good sleep. Right? So we have to think about our patients' habits and lifestyle routines because you can't put everybody into one box. Now, some of you are insane morning people. You like to be up before the sun and watch the sun come up and listen to the birds. And that's my husband. I think he's insane. But he also thinks that I'm insane because he doesn't want to stay up late and sleep in. Does that make sense? We have to remember that everybody is an individual and is going to have different habits and daily processes. Don't think that everybody is exactly like you because they're not. Good? Makes sense? So we'd want to find out a little bit about our patients. And we as CNAs are the best people to find out about these things because we spend the most time with our patients. We know when they have to go to the bathroom. We know when they prefer their showers. We know they like their bigger meals earlier in the day and just a small snack before bed. We know these things because we're with them all the time. Do you think the nurse sitting at the nurse's station knows any of that? So they have to rely on us to give them that information. Make sense? This is why we have to work as a team. We have information they don't have. And that's by design, because that frees their time up to do higher level nursing tasks. If they had to spend all the time with the patients with toileting and feeding and dressing and bathing and grooming, they would have all the information, but they wouldn't be able to get nearly as much done on the higher level tasks. Make sense? So that's why it takes a team to make this system run. If you catch yourself in a situation where it's you versus the nurses, the patient is always going to lose. That's who loses in that game, the patient. So let's learn about the leaves method. This in your skills book is going to be on page 85. Now, if you look on page 85, you see something that should look pretty familiar to you. Our chain of infection. Can you pass that down, please? Remember, the chain of infection is all about portals of entry and portals of exit, right? So if the patient has a wet body opening, like eyes, nose, ears, mouth, genital area, wounds, rashes, sores, or incisions, that's a way for pathogens to get out. So if we're going to wash any of those body parts, we have to be aware that pathogens may leak from them, and we don't want to transfer those pathogens to other places. So we have to have a way of washing those areas without transmitting pathogens. So we're going to use the leaves method. So if you take a washcloth, just a plain old washcloth, see, this is a square washcloth. You probably have these in your linen closet at home. And we usually fold them in half and then half again for storage. So you end up with a small square, right? That's what I just handed all of you. Instead of looking at it as a square, I want you to look at it as a diamond. Just a little quarter turn up. And if you have the free ends facing up, not the folded corner, but the free ends facing up, you can take this diamond with the free ends facing up and put it right on the palm of your hand. And then you're going to tuck in one side corner by your pinky, the other side corner by your thumb. And you now have a way of holding a washcloth that lets us wash wet body openings without cross-contamination. So the way this works is we're going to wipe something with the top leaf. So maybe an eye. And then we're going to fold that over so that any contamination gets trapped underneath. Then we can wipe the other eye. And we could fold that over so that any contamination gets trapped underneath. Then we can use this one to wipe the mouth area and fold it over so any contamination gets trapped underneath. And then we could use this to wipe the nose. So we have 5 separate, we've gone over 4. If you fold that one over, the back side becomes your 5th. 5 separate unique areas of the washcloth that prevent cross-contamination. This is called the leaves method, and we're going to use this anytime we wash a wet body opening. So eyes, nose, mouth, genitals, rectal area, wounds, rashes, sores, or incisions. Good. You can see that process on the second column of page 85. So here are our checkpoints for this particular skill. And of course, we're going to have skill rules, the opening, we're going to use a barrier. We evaluate gloves. For this skill, we're washing face. Face has wet body openings, so do I need gloves? Okay. We're going to use a privacy blanket because our patient's uncovered or undressed. We're working with linens, so those rules apply. We're going to have to turn the patient, so we scoot them toward us first. It's a washing skill. So whatever we wash, we rinse. Whatever we rinse, we dry. We're going to clean the basin the same way we clean the basin with everything else. The only thing that does not apply for this skill is shoe rules. Every other principle is used in this skill. It's a big skill. If you look at the bottom of the page, you'll see that it's going to take 86. You'll see that it's going to take somebody with your level of experience 19 minutes or less to do this skill. Okay. So we're going to wash the face first, no soap. We're going to use the leaves method on the face. We don't need the leaves method on the rest of it because it's all intact skin. So just a washcloth will work. You don't want a drippy wet washcloth. You want to wring it out really well and then apply soap to it. We're going to control the washcloth during cleaning. We call this no floppy corners. Imagine how that would feel. Right? That just would be a little on the icky side. You want to support the arm at the elbow when lifting. We've heard that before, right? We always support from below with a flat palm. We'll replace that water if it gets cold or soapy. We're going to turn the patient on their back to wash, rinse, or on their side to wash, rinse, and dry the back. Give them a brief back rub with lotion. Guys, it's not massage therapy. We're going to take our hands, get some lotion in them so there's no friction. Start at the bottom, small circles to the shoulders, come back down. Do that 3 times. Small circles to the shoulders, small circles to the shoulders, wipe off the excess. That's it. When you were a kid and you got sick, mom came along, just kind of rubbed your back real lightly. Always made you feel better, didn't it? That's what we're doing here. We're also helping to promote circulation because they've probably been laying on their back for a little bit. Good. So let me show you this video because it has good close-ups. Now, if you look at the bottom of the page, you'll see that you've got 19 minutes to do this particular skill. And my video oh, thank you. My video here, you can see the whole video takes not quite 13 minutes. So you've got plenty of time to do this skill. So I will often need Basin soap lotion. And I'll need some gloves. John, let me go get some water. I'll be right back. Ms. Jones, is the water appropriate temperature? Okay. And now I'm just practicing with it on over here. This will help keep you warm and protect your privacy while you do this skill. Spread the blanket without snapping. Shaking the blanket. Keep down, pull back the weight. I'm going to ask you to sit forward for me in just a moment so we can tie you down. And I'm going to slow this down before we leave you to keep your sheets from little baby. Can I get 6 feet of time, please? Thank you. I'm going to tie her down. Lay it in the toes. Thank you very much. And then I'm going to spread the towel out underneath you. Move the empty side closer to you before we get up to the
relocated out to the other side of the patient. This is the patient uncovered underneath the body of the gate. Like it would be, like it finally go. Take the first washcloth and lay it out. Now, it's four corners. We'll wash the face first. No soap on the face. It shows I'm going to wash your eyes. I'll start with the closest eye to me. I'm going to wash from the inner to outer corner. Very gently. And then we'll fold this sleeve over to prevent contamination from the other eye. The gentleman will wash your underwear in the outer corner. We'll fold that sleeve over. Very gentle strokes. Taking control over the wash. We'll fold that sleeve over and use the point of the arm. And then we'll set that aside. And take this one and put it forward. Face. And turn off the next step first. We'll set the towel aside. The one is taking some of the washcloth and lay it out. You don't need to move the weight to know that people fall over the stairs in this point here. We're going to wash the knee under the chicken. Across the chin, the neck, the upper circle, the legs, down the knee, and the foot. Then bring down the feet. We'll set this washcloth aside because that's so cool. We'll take the first washcloth to the base and the middle. It's all the areas to be washed. Maybe Service. We'll set the towel aside. Now the patient has a painful side. So we'll place it in the given one. Now the fingers are in here. Spreading out. Okay, so it's going to go up to the other side of the hand, and we'll now see it wrong. Since the care plan is that we are using.
Okay, Michelle, I'm going up to your turn on your left side here. This is what we're going to make. And then let's do for me. Ready? For me. 1, 2, 3. Body position. Taking care of one voice and then hands before we get to the elbow. This shows I want you to be able to do that now. So small your breath and circulation purposes. 1, 2, 1 more. And 3. Right off the inside of the foot. Down. Protecting the knees. Now, shows, come on back onto your back, please. And scoot to the middle of the neck. Thank you. If you don't want to touch the sheet, it's going to be a face of soil. This one's called the go into dirty knees. And then the base. See the base differences? And then take it up with the base. Get started. And now shows, I'm going to remove your privacy blanket now and pull your sheet back up. Are you comfortable? I'm going to roll the privacy blanket in a ball so that the framing edges don't intimidate other surfaces. This will be placed in dirty linen. Pivot down as a breathing if you want to do. So measure and
All right. Any questions on partial dead back? It's the longest skill we have. Students struggle with it because there's a lot of steps to it. But just remember, face to waist, front and back. You already know how to wash. Right? We've gone over the washing rules 3 times already. You already know to follow the care plan, to use a barrier, to do your opening and your closing, to use you know all of those things. So there's not much to actually learn about bed bath itself. As daunting as bed bath is, because it's long with a lot of steps, the one that students struggle with more is denture care. So that I'm getting ready to open it up for practice now. And that's one skill that I strongly encourage you to practice while you're here in this room, because we have dentures. You have the sink, you have gloves, you have denture, but you have everything you need to be able to practice right here. And if you try to practice this at home, you're going to run into some problems because you don't have everything that you need. So if you're going to practice any skills while you're here, I would definitely recommend ones that involve the mannequin and ones that involve supplies that you don't have at home, or consider purchasing the practice kit so that you've got everything that you need. Okay, good. Okay, so let me go ahead and pass out your review sheets. And then the rest of the class is going to be practice. We're finally at a point that we can start practicing in class. We're just past the halfway mark now. And so when I open it up for practice, the best way to practice is in groups of 3. So one person is the patient, one person is the CNA doing the skill. The third person should have that skills book open to the page and be reading the steps to make sure that the CNA is doing all the steps correctly. If you're working on a mannequin, you only need 2. If you're doing live patient skills, you need 3. The way to know the difference is at the bottom of the skill, you'll see whether it's a live student or a mannequin. Good. When I open it up for practice, you do not have to stay. It's adult education. You're free to leave at any time. If you're not practicing here, make sure you're practicing somewhere, because you're probably not going to pass the test if you haven't done the skills. I put free gifts out on the table for you. Make sure you grab one before you go. So that's from CNA week last week. So happy CNA week to those in progress. All right, rest of the class is yours. Okay. Oh, good. Sure. Right here. So if you watch the presentation from class 4, okay, good. So this tells you the 4 steps, and then this is the actual packet itself. Thank you. All right, YouTube world, I didn't see any pressing questions to answer before we sign off. So please make sure you join us on Wednesday for class 6 and Thursday for our live question and answer session. And the game show will be next Tuesday. So make sure you join us on July 4th for our next game show. Till next time, happy caregiving.